Hi everyone, this is Dr. Tracy McCarthy. Welcome to our long overdue discussion related to chronic coronavirus disease and disability. Now, there are some earlier discussions about disability and how to apply for disability, but we're going to be talking specifically about chronic coronavirus disease in this particular installment. Now, we're just going to be starting off with some of the symptomatic dynamics that might qualify individuals to apply for support in the form of disability benefits. And so we're going to go step by step through this to give you some insight into some of these diagnostic dynamics that you might want to be on the lookout for yourself or for loved ones. So we're just going to start off with looking at this disability qualification issue. And basically what you are looking for in terms of the disability qualification is a disability of 12 months or more. And so what this means is that an individual is unable to work for 12 months or more. That's the anticipation. And what you are looking for are symptoms related to an inability to perform basic work-related activities. And so these would be difficulties with things like lifting, standing, walking, sitting, and then in terms of cognitive ability, remembering things, being able to follow instructions or carry through with instructions that have been provided. Now, we've talked about these and some related issues before, but with respect to COVID, and we're just going to call this chronic COVID disease, that is the most appropriate nomenclature, basically. Some individuals are referring to it as long COVID or post-acute COVID disease, but appropriately, this dynamic should be simply referred to as chronic coronavirus disease. And so you have a couple of dynamics that present in many ways with respect to signs and symptoms that individuals have that make it difficult for them to function subsequent to being exposed to this SARS-CoV-2. And so one dynamic is that many individuals are experiencing what looks like an acquired autoimmunity, so autoimmune diseases. And then you have some individuals who are conversely experiencing acquired immunodeficiency dynamics. And so what you're seeing with those individuals is that their immune functioning is essentially exhausted. So in one instance, you have highly active immune functioning where the body is attacking components of the body. And then in some instances, you have the body not responding appropriately at all in terms of being exhausted from the fight. And so we're going to be looking at a number of signs and symptoms that point the way to some problems that people might be having in terms of just day-to-day functioning, in addition to problems with work. And as always, we like to go straight to the major science source. So we're looking at the National Library of Medicine here. And so there are a number of sources that have been coming out with respect to some of the dynamics that people have been experiencing in terms of their health subsequent to being exposed to SARS-CoV-2. And so one of the things that you might note, and people might note, is that, again, they are having significant autoimmune dynamics. And this has been manifested in a number of diagnostic tests that point out that there are autoantibodies in the body subsequent to being exposed to SARS-CoV-2. And in many instances, this autoimmunity looks like lupus, or things that fit under what I call the lupus umbrella. And so on the flip side, you have a number of individuals who have developed these acute forms of immunodeficiency. And this is coming about based upon immune cell exhaustion. And so with these cytokine storms, these extremely active immune responses, for some individuals, their immune systems are becoming depleted, exhausted, tired, and so their immune systems are not functioning the way that they would normally be functioning. And so we're just going to quickly look at some of the health conditions that the CDC has outlined so that you can have a better sense of some of the dynamics that might point the way to this chronic coronavirus disease. Now, before we even get started, I'm just going to point out that some individuals, some healthcare providers may offer that it's very difficult to actually find a cause and effect relationship with respect to exposure to SARS-CoV-2 and then a particular set of symptoms. And part of that is because the diagnostic picture for COVID was not quite clear. And so we've had quite a bit of time to examine the diagnostic criteria, but the diagnostic criteria is still not that clear. And so you have this chronic dynamic that is going on, but that chronic dynamic might not be a chronic dynamic. It may just simply be the way that this disease manifests itself over time. And so maybe it's not this acute dynamic that people have painted it as. And so it was painted by many as just basically a flu. But if anyone would actually step back and look at some of the symptom sets that people were presenting with, they can clearly see that this is something far and beyond a flu. And so one of the things that the CDC has pointed out is that the body's response to this SARS-CoV-2, this cat dog sort of virus, is that it impacts multiple organs in the body, or it has the capacity to. And so that includes the major body systems. And so you see individuals, or maybe you have experienced lung problems, heart problems, kidney problems, skin problems, neurological problems, including the brain. Some individuals, as the CDC has pointed out, have developed new diseases that were traditionally understood as underlying diseases, but now these are diseases that have made it to the forefront based upon the body's exposure to or response to this SARS-CoV-2. One disease is diabetes, and you have individuals who've developed, again, neurological problems and heart problems, in addition to some really unusual, atypical dermatological problems. There's also an ancillary dynamic that some people have been dealing with, and this is in response to having been in intensive care subsequent to dealing with coronavirus disease. And so those individuals may have problems with muscle functioning, connective tissue dynamics. They may also have issues related to cognitive processing. And some individuals have been identified as suffering from PTSD subsequent to being in the ICU. And so there have been problems noted with cognitive processing, judgment, decision making, memory, just thinking in general. Now, at this point, researchers are unclear about why certain individuals may suffer from what looks like chronic coronavirus disease and why some others may not suffer from this. We pointed out before that there are some genetic dynamics that are at play with respect to COVID. Some individuals, basically, they are just essentially immune to it. And those are those individuals with that CCR5 mutation that appears to confer this sort of super immunity on this percentage of the global population. What's also noteworthy with respect to COVID in America is that there appeared to be a prevalence of people with brown skin suffering the most. This was attributed to healthcare inequity, but that doesn't make complete sense because, in terms of the world system, those individuals with brown skin in the United States have access to the highest quality of care in terms of medical care that is available. So there has to be some other explanation for why these particular individuals out of the entire world were suffering the most. And you can do a comparison and contrast with respect to individuals in Africa and also individuals who are in the Caribbean. And so you do see these discrepancies. You also saw some discrepancies with respect to males and that Y haplogroup. And so that R1b was reported as having more difficulties. Those individuals were having more difficulties with respect to SARS-CoV-2. So there are a number of other dynamics that are going on other than simple health care inequity. That's not to say that that was not going on, because there is, of course, a problem with that at all times. However, you still have to compare this with what was going on in countries and regions that have significantly fewer resources. And so in terms of resources, those who are considered brown Americans, they are highly resourced. It may not look that way when you are in America, but when you are contrasting the situation with other countries, you have a group of people who theoretically have access to the highest level of care. Of course, that is theoretical, and it may not be the reality, or it may not have been the reality in this most recent situation, and that could be for a number of reasons. One thing to be mindful of, and this was noted with some children, is that some people have experienced this multi-systemic inflammatory syndrome. And so you have this inflammation that is pervasive throughout the body. And so that manifests in a number of ways. Of course, you do have a history of individuals who are brown in the Americas having a higher rate of some autoimmune diseases than other groups. And so there is a greater tendency towards inflammatory responses in terms of biological assaults or insults to the body. And so we see here additional information related to healthcare inequities affecting different populations in different ways. That's not really the big concern with respect to disability, because once the disability is there, that's the main thing that matters. It doesn't even matter as much the cause of the disability. It's the fact that the disability exists, and we talked about what those disabilities might look like in terms of functioning on the job. And so the healthcare inequity with respect to racial or ethnic background is not as important as whether the person can function. And just to give you an idea, you may hear healthcare providers refer to this chronic coronavirus disease by many names. You might hear long COVID, long haul COVID, post-acute COVID-19, post-acute sequela of SARS-CoV-2 infection, long-term effects of COVID-19. The most appropriate diagnostic label, according to my perception, is chronic coronavirus disease. And that pretty much says it all, fits everything neatly under that umbrella. and it makes sense in terms of standard nomenclature, in terms of what we typically call things in terms of diagnoses. Now, one thing that individuals might not be clear about is how long the symptoms may persist. And one of the things that has been noted in terms of the research with respect to chronic coronavirus disease is that these symptoms for many individuals have lasted for weeks in some instances, months in some instances, and for some people now, years. And you have a number of individuals who are significantly debilitated based upon exposure to this particular microbe. Now, for some individuals, they may not even be aware that they ever had exposure to coronavirus. And so, therefore, they may not attribute their symptoms to coronavirus. But again, if these symptoms emerged during the emergence of this pandemic, it's safe to assume that there is a likely connection between the manifestation of these symptoms or during this time period and potential exposure to the virus, the microbe that tends to present with the symptoms that many people are having. And we're going to look at some of what those symptoms are. And so for some individuals, they may have even had a mild illness, or they may have had what they experienced as no initial symptoms at all. But again, this goes back to a diagnostic dynamic because if individuals are looking at this as primarily an acute respiratory syndrome, they may not be on the lookout for other symptoms that may not manifest in terms of respiratory illness. And as we know, many people even start off with an illness that is gastrointestinal. And so it doesn't even necessarily start off with respiratory symptoms. Some individuals have connective tissue problems. Some individuals have had some cognitive issues going on, some dermatology problems going on, and so they may not automatically connect the symptoms that they are having with exposure to SARS-CoV-2. So those are things to keep in mind. There just may not be a clear line of correlation or a clear line of causation with respect to the SARS-CoV-2 and then the manifestation of the symptoms that might make it difficult for someone to work. Now, it's also important to keep in mind that there is no single litmus test for individuals who might be experiencing chronic coronavirus disease. But because there is no single test does not mean that individuals cannot be diagnosed appropriately with an appropriate workup. It's also important to keep in mind when thinking about the causation for the symptoms is that many people who have this chronic coronavirus disease, they didn't notice that there was a problem initially. And so many people, again, they just have no indication that there was an actual exposure to coronavirus. And it could be because they were looking for a particular set of symptoms. They were looking for these standard flu-like symptoms that may or may not have materialized. Now, to the best of your ability or the ability of your loved one, it's important to try to keep an accurate record of when the symptoms started, how the symptoms progressed, if there's any waxing or waning of the symptoms, any interference with work or school. And so it's important to keep these things in mind when trying to help your healthcare provider better understand what is going on with you with respect to the symptoms, because they may be able to help you trace it directly back to an exposure to SARS-CoV-2. But even if they can't trace it back, with this clear line, they still may be able to help you to get a better handle on when this started and what might have served as the trigger. Again, it's not essential that you be able to create this cause and effect analysis. The important thing is whether there are symptoms there that, again, are making it difficult or impossible, significantly difficult for an individual to continue to work. Another thing that complicates the diagnostic landscape with respect to this chronic coronavirus disease is this waxing and waning situation. And so you'll have some individuals whose their symptoms slowly improve with time. And then, as is characteristic of many autoimmune diseases, the symptoms go away and then come back yet again. And this might be after the passage of weeks or even months. At this point, it's also possible that it may wax and wane for years. Okay, now we're going to look at some of these symptoms that have been identified by the CDC that point the way to potential diagnosis and also point the way to the potential for disability and the need for support. Now, this is not an exhaustive list, but it gives you a general framework so that you can start to think about whether or not you have symptoms or experiences that fit under these umbrellas. And you can also look at some other research articles that might point out more specifically some of the dynamics that you might be experiencing. And so some of the general symptoms relate to tiredness or fatigue that may interfere with activities of daily living. Some individuals may have sort of a post-exertion fatigue, and so after physical effort or mental effort, the individual might experience themselves as being very fatigued or worn out or extremely tired. Some individuals may develop fever. And as would be expected, you see a listing of respiratory problems and heart symptoms. And so you see difficulty breathing or shortness of breath. Sometimes you might notice this when there is very little exertion. That's sort of a red flag. The individual might not be doing anything that would bring on this difficulty breathing or shortness of breath, but there the shortness of breath is. Coughing is another symptom. Also chest pain, fast beating or pounding heart, person experiencing heart palpitations. And a number of neurological symptoms have been identified, and those include things like difficulty thinking or concentrating. Some individuals describe it as sort of a brain fog, and so there are problems with memory, whether it's short term or long term. You also have individuals who are experiencing headaches, people having difficulty with sleeping, and this might be on top of some of the other physical symptoms that we just looked at. So sleep problems, some individuals might have vertigo, they may have lightheadedness, dizziness when they try to stand up. They may have feelings of like pins or needles pricking in their skins, in their extremities, in their fingers, in their feet. There may be a change in the sense of smell or the sense of taste. There have been some individuals who also indicated problems with sort of ringing in the ears. Individuals might also have some symptoms related to depression or anxiety or any number of other psychological difficulties growing out of the exposure to the virus. Now, again, it's not necessary to be able to establish this definitive cause and effect relationship between the symptoms and exposure to the microbe. It helps to be able to establish that, but it's not necessary. And so what is most important is that the symptoms are there and the problems that go along with it are there, even if you can't pinpoint what brought it about. And some individuals continue to have digestive problems. And remember, for some individuals, the first signs and symptoms are related to the gastrointestinal system. And if you recall, we discussed this earlier, that this particular microbe, it is transmitted fecal oral. So it can go straight to the gastrointestinal tract based upon things that one might put in the mouth. And so you have these diagnostic symptoms: diarrhea and stomach pain, difficulty with digestion. And of course, consistent with the autoimmune dynamics, you have individuals who are experiencing significant joint pain, significant muscle pain. Many individuals are experiencing atypical rashes, and then some individuals are experiencing problems with the reproductive system. And so changes with the cycle and changes in some other manifestations. And so all of these things are things to be on the lookout for, and also some individuals who had some underlying conditions. Those underlying conditions may have been manageable before, but the exposure to the microbe may have exacerbated the situation, and the symptoms may have worsened. And so you might see that in the situation with the joint or muscle pain. Again, joint and muscle pain, those two things tend to go along with many manifestations of autoimmune diseases, and particularly under that big giant lupus umbrella. Now, of course, for some individuals, this might be extremely overwhelming, and so it's important not to become discouraged by the situation and the difficulty with pinpointing, this cause and effect relationship, because individuals may take blood tests, they may have chest x-rays, they may have all sorts of diagnostic workups, and they might not come back with anything significant in terms of making that connection between the exposure to the microbe and the symptom set that the individual might be having. You also have the situation where healthcare providers may be stumped. They may not have an understanding of how to categorize these various symptoms. And if they are not clear that the individual has been exposed to SARS-CoV-2, they may not be clear about what they are seeing in terms of the symptom presentation. However, again, it's not as important that you have that cause and effect relationship, because there are other microbes, in fact, that can trigger some of the same things. And we've talked about some of those microbes before, including things like mycoplasma, of course. And so just because a healthcare provider cannot clearly see a cause and effect relationship does not mean it's not there. It doesn't mean that a person cannot receive treatment, and it definitely does not mean that a person cannot apply for resources in terms of disability benefits. Now, some people have applied and they have been denied, and also that should not be discouraging, because sort of as a matter of course, many people are denied the first time, the first few times even, and so it may require applying or appealing multiple times. And so just keep that in mind so that you don't get discouraged or your loved ones don't get discouraged. And also, it's important to keep in mind that back in 2021, this chronic coronavirus disease, also known as long COVID, has now been identified as a disability under the Americans with Disabilities Act. And so you can look back at older video discussions about that also, in terms of accommodations and modifications with respect to school or work. And so we're going to talk more specifically subsequent to this about some of these diagnostic dynamics and how they translate into this legal construct of disability. But for this conversation, I just wanted to make sure that you have an understanding of some of the dynamics that are related to COVID or things that are ancillary to COVID, that might set the stage for requiring resources while an individual is unable to work. For some individuals, it may mean that they are not able to work for a short period of time, 12 months or more, is the standard understanding, the standard rule. For some individuals, that may go on for a long period of time. It may go on for years. It may be a permanent disability situation. For some individuals, there may be a necessity to retire early. It's going to be different for each individual. But just keep in mind that as a society, we have a responsibility to take care of each other. And so there was this heightened focus on taking care of each other at the height of this pandemic. And so that philosophy of care needs to continue on in terms of making sure that those who have been working, who are now unable to work, are provided with the support that they need in order to continue functioning, not only to survive, but in order to thrive. And so we owe that to ourselves as a collective. And so when you think about a nation, you think about a family. And so that's what we have to be thinking about in terms of how can we take care of all of our family members. Remember, knowledge is power. Take care. See you soon.